At the Manning Conference with Stephen Fletcher, Winnipeg area MP, Conservative, and advocate for, are you an advocate for euthanasia or physician-assisted suicide? Margaret Somerville was explaining to me there is a difference and many people don't get it. What are you an advocate for?
I'm advocating for physician-assisted suicide when there is full consent of a cognitive adult. So someone who really understands what they're dealing with when they make the request. The issue of dementia came up today, and other kind of severe mental health issues like chronic depression. Those types of ailments would not qualify someone for physician-assisted death, according to the Supreme Court ruling. I introduced a private member's bill about a year ago on this issue, and actually is strikingly similar to the Supreme Court's final decision. So I was kind of flattered that they'd obviously looked at what was in my private member's bill, but they in that there are safeguards that would protect individuals from been taken advantage of. For example, they would have to see, they have to go through a process of 3 doctors. Anyone who has or could have a vested interest in the outcome.
Such as a child waiting on an inheritance?
Yes, exactly. Or an institution wanting to free up a bed, or you know, or any of the other unethical and morally corrupt scenarios you can think of, that they would be prevented, and moreover, that the individual making the request would now be in the system and be made aware of all the resources that are available to them, be it hospice care, palliative care, home care, and so on.
Let me ask you about this then, because you just mentioned hospice care, palliative care. We don't have that in sufficient quantities in Canada at the moment. Is that something that we need to remedy, as we also struggle with the Supreme Court decision and how to implement it? Because the Supreme Court decision, I may be opposed to it, it's going to go forward. Do we need to also be tackling the issue of palliative care, hospice care, and making sure that those that want it have it?
I would say yes, and also I would add the resources for persons with disability or non-terminal illness to be able to live meaningful and dignified lives, and that we should strive for that. And certainly what has been shown is that in many jurisdictions where physician-assisted death is allowed, the palliative care is amongst the best in the world.
I want to finish off with this. There's just been a debate about in Ontario about the issue of doctors deciding that there are certain things they will not prescribe or refer for. And this started out with the issue of abortion and the pill. A pair of Catholic doctors here in Ottawa actually who just would tell their patients up front, you can sign on with me, but I don't do this. Well, the college has said you must refer for whatever the patient wants. Should doctors, once this comes through, should doctors that have moral or ethical objections to physician-assisted suicide be forced to participate? Because it's pretty easy to go find another doctor that would be willing to do it, rather than say you must go against your personal convictions.
The Hippocratic Oath, which many people refer to, actually states that a doctor may have the right to or the ability to save life, and the doctor may need to take life. That's the Hippocratic Oath.
But should they be forced, if they have objections, should they be forced to prescribe something that they disagree with?
Well, it's interesting then if they're taking the Hippocratic Oath, because that would contradict that. But anyway, if an individual requesting physician-assisted death, a doctor would, I think, need to refer that person to another doctor.